right. Hi, everyone. It's the top of the hour, so we'll get today's session started. Thanks so much for coming to Accelerating the Speed and Scale of Medical Discovery with Real-World Data, Epic Research and Cosmos. My name is Erica Lake, and I'm the Medical and Academic Library Outreach Coordinator for Region 6 of the Network of the National Library of Medicine, and I'll be your host for today's session. We have just a few items to cover before we get to our presentation. All attendees have been muted, but we do welcome your questions and comments in the chat at any time. Miles Dietz-Castell, Region 6's Communications and Finance Coordinator, is providing technical assistance today, and he'll be keeping an eye on the chat with me. Please be sure to select everyone from the drop-down menu and posting your questions in chat to ensure both Miles and I see them. We'll queue them up as they come in and save them for our speaker to address at the end of her presentation. Closed caption has been enabled, and it's available by clicking on the icon with the 3 dots and then selecting closed caption. We are recording today's session, and we'll post it on our YouTube channel in 1 to 2 weeks. And at that time, everyone who registered for the session will receive an email from us with the links for the recording. We do have an evaluation link for this session, which we'll share at the end. And your feedback really matters and helps us improve future training, so please take a moment to complete that. Since some of you might be first-time attendees to one of our webinars, I'd like to share just a few words about the network. NLM, the National Library of Medicine, is one of the 27 institutes and offices of the National Institutes of Health. It's the world's largest biomedical library and produces online resources like PubMed and Medline Plus. NNLM, the network of the National Library of Medicine, is an outreach program of NLM, working to ensure health professionals and the public have equal access to health information. NNLM is made up of 7 regional medical libraries, 3 national offices, and 4 national centers, all providing training, funding, and engagement opportunities to over 9,000 NNLM member organizations. Region 6 covers the Midwest, and it includes the states of Iowa, Illinois, Indiana, Michigan, Minnesota, Ohio, and Wisconsin. If you'd like to connect with one of your regional medical libraries or learn about how to become a network member, you can check out our website at nnlm.gov. So today's session is part of our Speaker Spotlight series. It was organized by Region 6. And this series features expert guest speakers presenting on topics of interest to all of our users, which include librarians, public health practitioners, educators, clinicians, and others who work with health information. There are a number of ways you can learn about upcoming Speaker Spotlight sessions, our other training opportunities, and our regional funding announcements. You can subscribe to our Region 6 newsletter, you can check out our blog, and you can follow us on social media. In fact, Miles will be live tweeting during this presentation if you want to follow along with us right now. So it's my pleasure to introduce our speaker for today's Speaker Spotlight. Danessa Sandman coordinates operations across Epic Research, working with Epic customers, academic researchers, and government officials, and other public and private partnerships to further medical and public health practice. Danessa also has experience implementing software and population health programs across several of the nation's leading accountable care organizations and clinically integrated networks. From March 2020 to July 2020, Danessa directly served as part of the state of Wisconsin's early COVID-19 response, working alongside state and local health officials and administrators as a member of the State Emergency Operations Center. And prior to joining Epic, Danessa provided patient care in both acute and post-acute settings and work to advance health policy at the federal, state, and local levels. So welcome, Danessa. I am going to now stop sharing. I'll turn the session over to you. Thank you.
Thank you, Erica. I will pull up my screen here and my presentation. All right. Thank you again, Erica, for having me today. I'm excited to talk a little bit more about Cosmos, and we'll start there with an overview of Cosmos, which is a research data set that is available. And then I will move on to talk a little bit more about Epic Research, and some of the work that we've been able to do with Epic Research in some of those partnerships and collaborations that I mentioned, as well as some of the publications that we've made available on epicresearch.org. So starting first with Epic Cosmos. Epic Cosmos is a database that organizations that use the Epic electronic health record can choose to participate in. So they provide a HIPAA-defined limited data set of information from their electronic health records that is then deduplicated and brought back to a central repository where those organizations that are participating can complete research and do different types of analyses. We have over 1,000 hospitals, 22,000 clinics across 190 different live healthcare organizations that are currently participating in Cosmos. And there are 180 million deduplicated patients in Cosmos today. That number continues to grow as those organizations provide care for new patients. Patients are seeking care at different places and needing healthcare across the continuum. We do have patients that are in all 50 states and also have patients from Lebanon, which is our first international community member participating in Cosmos. And we represent a wide variety of care settings. So there are rural hospitals, academic medical centers in urban areas. We also have a number of federally qualified health centers, safety net hospitals, and other areas that care for the underserved. The Cosmos dataset is also very representative. Here we've compared the population in Cosmos to the population percentages set forth by the United States Census Bureau. And you can see when we compare the age, race, ethnicity, insurance coverage, and social vulnerability index across those two populations, they're quite comparable. So we have the opportunity to complete analysis and research and investigations that's very representative of the patients that are being seen across the US and even in the international space. When you think of an electronic medical record, there are some things that most people probably assume are available in a data set like that. But Epic is really inclusive across many different sites of care. So we have information about hospitalizations, ED visits, urgent care admissions, as well as the outpatient primary care visits, specialty visits, and all of those types of things. But we have a number of other data sources that are available and documented as part of that complete and longitudinal record for that patient. As I mentioned, they are deduplicated patient records, but it continues to provide information about their outpatient care, inpatient care, even community care, or outside of the hospital or clinic walls, to include patient-reported outcomes, wearable health data, information that patients might put in through the patient portal. MyChart, if you're familiar with that. Patients have opportunities to complete questionnaires, complete other documentation that can be captured and shared as part of this Cosmos database. We have a number of things that are documented. This is all based on discrete documentation in the electronic health record. So we're able to bring that back to a common data model and be able to compare some of those outcomes across the larger population. Cosmos was designed to not only support research and populations on the one end of the spectrum, but also be able to provide data-driven insights to providers at the point of care for their patients. So they're able to participate in collaborative decision-making through tools called lookalikes and best care for my patient that we've been working on for those that are using Epic as a EHR software in their care practice settings. Today, we'll focus primarily on some of the research capabilities of Cosmos, and more specifically, the opportunities we've had with Epic Research using the Cosmos database. As I mentioned, organizations that participate in Cosmos are able to use Cosmos to determine and get insights across the entire Cosmos population. So they have access to all of the data contributed by those organizations that are participating in Cosmos. And one of the CMIOs at an organization Dr. John Lee was at Allegheny and was able to do some queries and post the findings of Cosmos and share those widely. So that's something that's very important to us, being able to share and make data available to those where it can make a difference. And so he was able to look at the differences in severity as far as hospitalizations go, ED visits go, very early on in the pandemic, as well as understanding how influenza infections had changed over time, given the rise of COVID infections. So these were a couple of examples of queries using a tool called Slicer Dicer, which allows groups to enter and explore more information about a number of different conditions using the Cosmos dataset. Additionally, medical students are making great use of Cosmos and the data that's available there. A physician, medical student, Jane Hinkle, was able to win actually an Outstanding Oral Presentation Award for the investigations that she completed using Cosmos, looking at the incidence of myocarditis following COVID-19 infection and the incidence of myocarditis following COVID-19 vaccination. So she was able to use that and present that as part of her presentation and was awarded in doing so. Additionally, we have several studies now that have been published using Cosmos data in more traditional academic research resources. So here's an example of a research collaboration that was done with Penn Medicine, Yale New Haven Health, and Nemours, and a collaborative of researchers and physicians who worked together to look at outcomes for pregnant persons during the COVID-19 pandemic in the early days of the pandemic. So we were able to look at a number of different birth outcomes, such as low birth weight and preeclampsia and a few other types of things as part of the investigations that were completed, submitted, and published in the American College of Obstetrics and Gynecology Green Journal. And so those are some more kind of traditional methods of being able to use and leverage Cosmos and be able to provide insights from that vast database of over 180 million patients. Epic Research we launched Epic Research at the start of the pandemic in April of 2020. Cosmos was in development well before that, and we were able to start providing insights very quickly about COVID in the time of public health need. So because we have a common data model, we were able to bring together a lot of those key factors and provide that information in a variety of formats. As such, Epic Research is designed to rapidly share knowledge to help solve medical and public health problems. And we're always looking to get good data out quickly into the hands of clinicians and decision makers where it can make a difference. So we're looking for really to drive action from the data that's available and be able to provide some more insight where that might not exist yet. We've created a unique dual team study process to support our goal of getting data out quickly and also support accurate findings and making sure that we feel confident in the data that we are putting forth. So we take an initial study idea and define that study question. And then we have two separate teams, each that consists of a clinician and a data scientist, go and design and develop their analysis. And then they come together to compare their results and verify that we are seeing similar things across the different analyses that they have completed. And then we move on and write that up as a brief, which we publish on epicresearch.org. And we send that out to subscribers as well. So anytime we publish a new brief on Epic Research, we send that out to our subscribers so they can be made aware of any of the new findings that we have. The goal of our research and our briefs are to be able to put the data straightforwardly out and make it available widely. So we do publish primarily on epicresearch.org, but we have published in a few other places with and more traditional research models as well. And I'll talk a little bit more about those. Here's an example of one of the early studies that we did. So back in, I believe it was June of 2020, we released our first study that showed that there had been a significant drop in the number of screenings for breast, cervical, and colon cancer. You can see the example here of the graph on the top left of that initial drop. After we reported that, a number of healthcare organizations were able to really focus in on getting people in for their preventative care and determine how they would be able to make up for some of those missed screenings. And we did start to see the rate of screenings increase again in a follow-up study. As that continued on, we were able to do another update, as this is something that was of continued interest to both public health groups, those that are really interested in preventive medicine, as well as making sure that our populations remain healthy and we're able to identify cancers early when they have the best chance for treatment. We just recently published on the number of cancer diagnoses, as well as the more advanced or severe cases of cancer in those three areas of breast, colorectal, and cervical cancer as well. And we found that screenings have largely returned to their normal rates, and we have not seen an increase in cancers being detected or more severe cancers as of the end of 2022. We also worked with a physician who practices over at Eastern Virginia Medical School on this study, looking at the rates of cesarean section for patients with a BMI over 40. And the physician had previously attempted to do this study, but was unable to really be able to define out BMIs over 40 outside of that. They just did not have enough patients in the data sets that they were looking at to really be able to determine and kind of create a gradation of BMI in that space. With Cosmos and the volume of data that was available, we were able to actually stratify that further. And you can see here in the purple that we were able to stratify that from 40 to 49, 50 to 59, and 60 plus in BMI to have an even greater understanding of the potential outcomes that patients were seeing in each of those ranges. We did publish a study that we published on both epicresearch.org and in New England Journal of Medicine Catalyst, looking at antibiotic prescriptions for conditions and the use across telehealth and other types of office visits, and whether or not a diagnostic test was performed prior to the antibiotic prescription in each of those settings. So this was something that was very interesting, especially as we started to see more and more use of telehealth across from the start of the pandemic and how that's changed over time, understanding how some of the outcomes and clinical practices have changed or how they might be impacted by the rise of telemedicine. I mentioned some collaborations. We've actually worked directly with the Centers for Disease Control and Prevention, epidemiologists, physicians, and researchers there to publish 2 morbidity and mortality weekly reports. We first published with them on the effectiveness of COVID-19 vaccination and preventing associated hospitalizations for those individuals in April of last year. And then near the end of last year, we looked at Paxlovid as an antiviral medication and how that impacted hospitalization rates across those patients as well. So we were able to use the data in Cosmos to provide some of these great insights to pair with the data that they use and the reports that they have at the federal level for CDC. This data from Cosmos was also used and presented to the Advisory Council on Immunization Practices. So we were able to provide that information initially looking at what the efficacy and incidence of those who were vaccinated were on hospitalizations, ED visits, and that information there as well. And ultimately, the committee recommended the approval for the boosters following the presentation of that information. Additionally, we were able to provide information about the incidence of myocarditis in pediatric patients, which was presented to ACIP again to understand some of the potential impacts and implications of COVID-19 in the pediatric population. So this is also a continued area of focus, looking at how the COVID-19 infection, as well as impacts of that ongoing and vaccination recommendations might be. So those were both presented in a SIP. And here's another one. That's something that we continue to do, is make this data available to decision makers and stakeholders so that they can make data-informed decisions as they're driving forward with these very important recommendations. As I mentioned, we do publish our briefs on epicresearch.org, which is available to everyone for free. You can subscribe to receive each of our new studies at epicresearch.org/subscribe. You can also use these QR codes if you'd like to bring you directly there. We also welcome ideas to be researched on epicresearch.org. So there's also a submit an idea button up at the top right-hand corner of the Epic Research website. And you can use this QR code here on the right of your screen if you're interested in submitting ideas. We really look for ideas, as I mentioned, that can drive clinical action, are providing new novel information, and often spur future investigations as well. We really want those who are doing academic research to be able to drive forward a number of those types of things and we provide really early insights into some of those things that might warrant some additional research there as well. We similarly have social media on Epic Research over on Twitter, where we share some of the key findings from our briefs that we put forward there. So you are welcome to follow this there as well for the latest on what we're presenting. And so that kind of covers what I had for this morning, looking at both Cosmos as a data source and resource. We do have a website, cosmos.epic.com, where you can find out a little bit more about Cosmos. And then at the bottom of the page, you can also see the organizations that are currently participating in Cosmos. Those organizations do have the ability, as I mentioned, to do research on Cosmos and drive a lot of that work forward. We also have a number of organizations who have also published their own studies using the Cosmos data and can be great resources for organizations that might be interested in how Cosmos data might be able to drive some of that discovery forward.
Oh, terrific, Danessa, thank you. We have a couple questions that are coming in. The first one, and they state that they may have missed this in the first part of your presentation, but is the data de-identified? And if so, how is it de-identified? And how do patients consent to this data use?
Yes, so the information is it is defined as a HIPAA-defined limited data set, which is available for research. Each organization manages the consents for their patients, and that data is all essentially de-identified to the HIPAA-defined limited data set before it ever leaves their organization. So that identifying information, such as demographics, all of those key pieces, is not ever sent to Cosmos, so it's not identifiable there. We have a tool called Care Everywhere, which is part of our interoperability framework, which allows organizations to exchange and supports the deduplication of patients. So you can understand if a patient's been seen at one organization, if that same patient has been seen at another organization for care as well. And so we built on those interoperability frameworks that are used for deduplication across those efforts. So that actually occurs prior to it being sent to Cosmos, such that we're able to preserve the data privacy and limit any identifiable information that is brought into Cosmos data before it ever even gets there. So that matching actually occurs outside of Cosmos before it is sent over to Cosmos to help support that de-identification. There's a little bit more about some of the security and privacy practices of Cosmos on cosmos.epic.com near the bottom of the webpage if you're interested in learning a little bit more about some of those key practices. But there's not identifiable information in Cosmos. And HIPAA really defines what the appropriate use of data in the data set is according to the limited data set and what's required for that.
Thank you. You actually just made me think of a question. I know that the ability to get death data varies by state. Is there some coordinated way through Cosmos that you'll automatically have the death data that you're eligible to receive and then not accidentally get things that you shouldn't be viewing?
Yes. So mortality data is a very interesting topic and very valuable from the research perspective, as well as some of those patient cares perspectives. Right now, the death information that is available in Cosmos is mostly a death data for those that have passed while they are at the hospital. So if they passed while they were at the hospital or receiving care at the hospital, that is updated locally in the actual patient identified version of that before it ever comes to Cosmos. So just those that are documented there and in the way that they are identified are brought forward into Cosmos right now. We are looking for ways. It's important for the clinical care of the patient to be able to understand some of those deaths that happen outside of the hospital setting as well, especially as we're looking to care for populations of patients, making sure that they're able to get what they need for that, and communicating with patients and their families as well, and making sure that we aren't inappropriately sending documentation or things like that after a patient has passed. So we are working to better understand ways to share information that is shareable a little bit further upstream, so that those that are caring for the patient have the information that they need there as well. So just the information that is documented in the EHR is the information that is shared back to Cosmos. So that's kind of how it works today. And we're working on ways to actually bring mortality information up further upstream for those that are actually caring for the patient, so that they have the information they need to provide the best care.
Thank you. We have another question that's come in. In the absence of an NPI, how is data deduplicated across different health systems?
Yes, so as I mentioned, we have the ability to we use a framework as part of interoperability called Care Everywhere that looks at demographic information across the different groups and kind of assigns them it does that deduplication across those records before it's sent to Cosmos. So all of those key pieces are there to drive that forward on that de-identification. I don't have, it's a pretty complex piece of different weights and things like that, that our health information management teams are very involved in, on understanding, with what confidence level can we have that this patient is matched to this patient, and so on and so forth. But that's all occurring as part of the electronic medical record and direct care of the patient. So we're able to take advantage of the deduplication efforts that are provided there prior to sending that data to Cosmos, so that we're able to have those deduplicated records.
Thank you. We did have one comment that came in, and the person stated, "I don't doubt that you handle consent correctly, but please note that a limited data set is not de-identified according to HIPAA."
Yes, great clarification. So thank you for bringing that up. So limited data set is not specifically de-identified. We do have an expert determined de-identified data set that is used with the data science tools that are available there. The limited data set is used specifically with tools that have additional privacy and protection capabilities on top of them, using our Slicer Dicer functionality. So Slicer Dicer is a reporting tool that allows people to query the overall data set and has protections for there's no line level data that's available there, and anything else that is under count of 10 shows as 10 or fewer to help with protecting the patient privacy and limiting any chance to identify those individual patients for so that information. So that is a good clarification. It's a little bit complex, but we do have the de-identified data set that's available with the data science tools, which is what many researchers are using for some of those line level data, which is a de-identified data set. And then the limited data set has additional protections on it through the querying and viewing data analysis tools in Slicer Dicer for that function as well. So there are only certain filters and things that are available to be visualized with that capability.
Thank you, Danessa. Another question that we've had come in, what kind of standard data model mappings, such as OMOP, that is common in research, and standard vocabularies supported by Cosmos data? And how are these vocabularies normalized across different health systems?
Yes, so we participate in OMOP. The Cosmos data set isn't exactly OMOP, but because the participating organizations have a common data structure, we are able to say, because they are all using the EPIC EHR, those EHR data places and where that data is stored is common across those areas. As part of our implementation of Cosmos, to those that are choosing to participate in Cosmos, we do have a few different mappings that we do with each organization to verify that those labs are consistent across the different instances where they're documenting information about social determinants of health across those different viewpoints are all viewed, are all considered, as well as we bring it into that common data model. So it is a Cosmos common data model that we're bringing in for that. And there is, for those that are using the tool, we do have data dictionaries and other information about how those things are. And there are a lot of parallels to understand that. In those key things, it doesn't exactly follow OMOP, but we work very closely with the groups that are working with OMOP and to understand kind of what those common data model and definitions are to help with each of those pieces. One thing that is probably a little bit unique about Cosmos is that no line level data leaves Cosmos and data cannot be sold. So the insights from the Cosmos data are able to be brought out and shared, but the line level data itself is not ever brought out and shared for each of those kind of areas. So that is one consideration that might be a little bit different about how we use Cosmos and the tools within the Cosmos framework for that. As far as standard libraries go, we have several tools related to medications. So we use Rx norm codes across FDB and oh, there's another one that I believe starts with an I, but I'm blanking on it right now. First National Data Bank, and then there's another one that I believe is, oh, there we go, Metaspan. For those with the Rx norm codes to help normalize medication definitions, we do have ICD-10 SNOMED CPT codes across many of those areas as well, LOINC for labs, and continue to look at other data definitions and libraries that are standardly available to help support research using Cosmos.
Great. Another question we have is, will EPIC ever make Cosmos data available to non-participating health system entities such as pharma or other tech vendors via APIs?
We don't expect that data will likely be coming, as I mentioned, data can't leave Cosmos, but we do have organizations. We have been trying to understand, we understand there's great value, as I mentioned, in real world data, in real world evidence. So we've been working with groups in some of those areas to determine how we can best support, how Cosmos might be able to support the development of real world evidence, ARNs, or understanding some of those key areas as they look at development, research and development for new therapies and medications and some of those other areas as well. So we expect that many of the organizations that are participating in Cosmos might collaborate with some of those groups on how we can best use Cosmos there, but it's unlikely to be through APIs from Cosmos. We do have a number of organizations, though, that use APIs to share information from their EPIC EHR and make data available through those key pieces, and those fall a little bit of a different process, usually with some of the patient consents and the relationships that those organizations have directly with those vendors. So it's a little bit of a separate process where they're contracting or working directly with those organizations providing care.
Great, thank you. Could you address a little more about how the data interacts with the patient care record, if at all?
Yeah, so at the interaction with the patient care record, most of the data that's in Cosmos is information from the patient care record, but again, is that limited data set coming back. So the pieces that I mentioned, there's not as much direct interaction with an individual's chart or electronic data record or kind of bringing that back. It's really that aggregated data to be able to do population level analyses in Cosmos. There are some tools that we've talked through from some of the different perspectives on some of those things that I mentioned, but that's all managed on the local level. So our local organizations do a lot of those key pieces and bringing that back to identify organization or patients where they might want to do follow-up or some of those other types of things. We've also been looking for ways to, if we identify something from one of our population level, maybe nationwide searches as a trend or some of those key areas for organizations that are participating in Cosmos to be able to replicate those queries and analyses on their local systems, and then using their own processes, policies, and things like that, they can manage those outreach to patients. So there's not any direct interaction with the patient record themselves from that perspective because of the way that we are kind of working to limit the data set before it comes in to the system from Cosmos. But we do have ways that organizations can kind of take action on the findings of those EPIC research studies that we might put out using the Cosmos data or those other areas. And those organizations are also able to kind of, within the Cosmos data set, they can limit it to their own organization if they want to see, this is what it looks like across the entire population that we have. This is what it looks like for our population. And then they can recreate those pieces there.
Great. Well, I have a question for you. So we have a growing number of hospital and academic librarians who have integrated library services into EPIC or into other electronic health records. And we always are trying to get evidence of our effect on patient care and outcomes and cost, but there are still so few of us that are in there. So is there a collaborative platform on EPIC research where librarians who have access to EPIC can find each other and try to come up with some research studies and then utilize the data together?
Potentially, I think there's a few different places where we have a very active peer group in a number of different areas. We have an annual users group meeting where we have peer-to-peer presentations and things that focus on each of those areas. We also have a data science symposium in the spring to talk a lot about where we talk more about Cosmos and some of those kind of key pieces. To my knowledge, I don't know that there's a specific group for librarians that's already been identified, but that's absolutely something we can help support through our user web communication portal or some of those other areas. So if there is interest, feel free to reach out to me. It's Danessa at epicresearch.org, and I can help coordinate what that might look like and help with bringing some of those folks together across the larger EPIC community, and we'd be happy to do that.
Ooh, awesome. All right. And those annual group meetings and the other, I think you mentioned a presentation that you do. Where would we find information on that?
Yes, so we have information on each of those through what we call the EPIC user web. So organizations, so folks that are affiliated with a organization that uses EPIC can go and create an account on the user web. I believe it's userweb.epic.com. And can sign up for an account there. And we have a number of different tools available there and a lot more about each of the individual events ugm.epic.com is our users group meeting website. So you can see more information about when that's planned. There will be in the upcoming months, usually that's in August of each year, the users group meeting. And that actually occurs at our campus in Verona, Wisconsin. So for those that are interested, or maybe some of you have been before, it's a great experience, about a week long, where we have a number of sessions to talk a little bit more about how users are using the software, the outcomes they've been able to achieve, and some of those key areas, as well as preview some of the new things that are coming with the software as well.
Great. And do you have any like teasers you can give us of research studies that are in the works right now that will be shared in the upcoming months?
Sure. Yes, always happy to talk about some of the kind of key areas that we've been focusing on. One of the additional areas that we've been focused on, we've recently published on telehealth follow-up. So how often are patients coming in for a visit after they've had a telehealth visit across different specialties within that same specialty. So as we look for, there's a lot of policy and decision-making. There's been recent extensions of telehealth waivers for Medicare and Medicaid patients in many areas. And peers are looking at some of those different care delivery models. So our previous study focused on specialty care. We have an upcoming study that is focused on primary care settings, since that looks a little bit different, the care delivery in the specialty areas. We also have a few different studies looking at some of the various outcomes across in the behavioral health space. So looking at incidences of ADHD and postpartum depression and some of those other areas as well. So we've got a few coming up. Behavioral health is a very interesting area for us. And when we are looking at pregnancy, real world evidence is a very, many clinical trials do not include pregnant patients for a variety of reasons. And so being able to look at outcomes across pregnant patients is another area that we have a few studies that we're looking at coming forward as well. So those are some of the key areas of interest that we've been driving forward. Cancer screening and diagnosis continues to be very important to us, as well as we understand some of those changes over time. We also have a number of groups focused on opioid use disorder, medication-assisted therapy, and a couple of more comprehensive approaches to some things in that space. So that's another focus area for some of the upcoming studies that we have. As I mentioned, we do welcome and look forward to ideas that you all might have that could be answered by the Cosmos data set, and you can submit those through epicresearch.org/ideas. And we very much love to hear from those that are working in the industry. If you have questions or hypotheses that you'd like to see tested across 180 million patients, we absolutely welcome you to submit as many ideas as you like at any time.
Oh, well, that's great. Danessa, thank you so much. It looks like we've gone through all of the questions right now. So I will post this up on the screen for our attendees. We do have an evaluation link for this session, and that does work best if you copy and paste it into a browser. I think maybe Miles, if you're able to copy and paste that into chat, that would be great. Thank you. And then we'll also send out that link to the recording. And Danessa, thank you so much for your time today. That was fascinating. And to all of our attendees, thank you so much for attending. We'll go ahead and cut just a little bit short, give you back a little bit of time in your day. And everybody have a great afternoon. Thank you so much.
Thanks for watching. This video was produced by the network of the National Library of Medicine. Select the circular channel icon to subscribe to our channel, or select a video thumbnail to watch another video from the channel.